Good morning, everybody. Hope you can hear me okay. This is our Mesothelioma UK's third Facebook Live session. My name's Liz Darlison. I'm Head of Services at Mesothelioma UK, and I'm also a consultant nurse at the University Hospitals of Leicester. And that's where I am today. I'm here today. Tuesday is one of my usual clinical days. So we've been covering lots of different topics over the last few weeks, and this morning I thought I would talk to you a little bit about telephone consultations in particular. Many of you will already be aware that most cancer follow-up appointments are now going to be carried out by telephone rather than face-to-face, and I think that that's different how we usually work, and it might help for us to just talk a little bit about how we're preparing for those telephone consultations and what you might like to do in order to prepare yourself. So I've prepared a bit of a checklist, and I've asked Julie back at Meso UK HQ if she wouldn't mind putting this together on a sheet of paper so that we can put it out there for you to download and just use as your own little checklist. So it'll be a bit of a checklist, a bit of a pro forma. So I think the first thing is to say that your appointment letter may have on it a time, but it's very likely that your call will not come at that time, much the same as in the clinic situation. So whilst your letter has got a time on it, just be prepared to be available for that clinic session. So keep one ear on your phone during that afternoon or morning that you would normally be attending the clinic. I'm sure the doctors and nurses will try to keep to times where possible, but given the current situation that everybody's working in, that may not be possible. So just keep one ear on your phone. Also bear in mind that not all phones have a loudspeaker facility, and if you have got a family member living with you in the house who you would like to listen into the consultation, just have a little practice with your landline phone to make sure that the hands-free loudspeaker facility works and you know how to use it. And if your landline doesn't have that facility and you would like to transfer the call to a mobile phone, as soon as you get the call, just let the other person on the end of the phone know that you would prefer to have the call on your mobile phone, for instance, because you'd like to use the loudspeaker facility so that your family member can listen in. So just have a little practice, and if not, at the start of the call, just say, would you mind ringing me on this alternative number? And perhaps just remind them to have that number recorded in your notes for future consultations. I also think it's worth remembering that the doctor or nurse that is calling you for that consultation may not be a member of the team that you have met previously. Of course, they're always going to try and do that. They're always going to try and link you with a doctor or nurse that you are known to. Makes the consultation much smoother, and you start off at a different place really than if it's a complete stranger. But that may not be possible. So we've put together a list of things that you might like to have prepared to help the doctor or nurse who is calling you. So the first thing I'd like to advise you to have ready is your hospital number. Your hospital number or your NHS number. And the person calling you is likely going to check your name and date of birth at the start of the consultation to make sure that it tallies with the set of notes that they've got in front of them. So it's useful for you to have your hospital number or your NHS number available as one of those checks. It's also useful for you to succinctly be able to answer a number of questions. And the first one I'd say is, what is your diagnosis? So are you left malignant epithelioid pleural mesothelioma, right malignant epithelioid, peritoneal mesothelioma, epithelioid subtype? You should be able to find this information on any of your clinic letters, and some of you may know it. So it's not, it's not absolutely vital, but it's just helpful if you can say, yes, I was diagnosed with right-sided malignant epithelioid pleural mesothelioma on the 22nd of November 2018, or something like that. So your diagnosis and the date of that diagnosis. The next thing I would say that it would be really useful for you to have available is information about any treatment that you've had to date. So first off, I would say, what surgical procedures have you had? So you might say, I had a surgical biopsy. They put me to sleep for that biopsy, and I had that done on December the 4th, 2018. radiotherapy. Now, not many patients will have had radiotherapy, but if you have, it'd be really useful to know what date that radiotherapy was. So I had radiotherapy between the 2nd of January and the 15th of January, and I had 10 treatments, and perhaps where you had that treatment too. And then finally, the bigger one, and the one that's a bit more complicated probably, is anti-cancer systemic treatment, chemotherapy, immunotherapy or targeted treatment, any drug treatment that you might have had. So what treatments have you had? Were they in a clinical trial or not in a clinical trial? What date did you have those treatments? Perhaps how many cycles you might have had? And more importantly, what was your response to that treatment? So how did the mesothelioma respond to that treatment? And how did you personally cope? So did you cope really well, or were you admitted to hospital? Did you have problems with infection, really bad problems with nausea, or did you sail through your chemotherapy? So just to recap, what drug treatments have you had? Was it in a trial or not in a clinical trial? What dates was that treatment? How did the tumour respond to that treatment, and how did you cope with it? The next thing I would suggest is that you just have available to hand the last CT scan date. So when was your last CT scan, and which hospital did you have that at? It's possible that the doctor or nurse should have that to hand, but it's also possible that they don't, and they'll be looking it up on systems during the consultation, and it's much easier for them to know what date that they're looking for, and just to confirm that you actually attended the date that they've got in the notes that you should have perhaps had that scan. The fourth thing I'd ask you to have to hand is any medication that you're on currently, and particularly if you've had any change to that medication, that's also useful for the doctor or nurse to know. And then I guess here's the crux of the matter, is how are you feeling? So how are you today? How is your pain? How's your breathlessness? Have you got a cough? Are these things better than they were before or worse than they were before? When we're thinking about pain, we often like to put a number on that. And some of you will have heard the scoring system 1 to 10. So if you have got pain, it's really useful if you can say to the doctor, I have got pain. It's much the same as it always has been. It's scoring about 3 or 4 out of 10. Or when I've had my painkillers, it goes down to 1 or 2 out of 10. So that kind of conversation, again, it's really useful for you to have that information ready. They may also ask you about your energy levels. What's your appetite been like? And if you have got some scales to weigh yourself, it's not a bad idea just to keep an eye on your weight. So if you could say, you know, my appetite's been good and I haven't lost any weight. I weighed myself this morning and I'm still 11 stone 4 or in kilograms, whatever. That's also really helpful. So the doctor or nurse may also want to ask you, if you have had a surgical procedure, how your wound is doing. And clearly, if your surgical procedure was more recent, they will particularly want to know, you know, about the healing process and how your wound is looking, and just check if there's any concerns. If it's some time ago, they might be more interested. Have you examined your wound lately? Have you noticed if there's any lumps or bumps in your wound? And they just want you to simply report back anything that you might be concerned about. If you are somebody who has a permanent indwelling chest drain, they would probably want to ask you about your chest drain management. So any concerns with your chest drain? Is it still draining? What does the drainage look like? How often are you having it drained? Just the usual type of questions they would ask you when you go to your clinic consultation. Now, the other thing I would suggest that you do is just to have any questions or concerns written down so that you have them to hand for the doctor or nurse during the telephone call. And at the end of the call, please just clarify with them what the next steps are. So it's a repeat CT scan. They might want you to have a blood test before your next CT scan, and that an outpatient's appointment will be arranged for 2 weeks after that, which in the current situation is likely not to be face-to-face. It is likely that these will continue as a telephone follow-up for the foreseeable future. So just make sure at the end of the consultation you clarify what the next steps are. And I would also take that opportunity to just check with them if I have any concerns in between my appointments who they recommend that you contact. And hopefully for most of you, it will be your usual key worker, your cancer nurse specialist, your Mesothelioma UK nurse. But just clarify that, because obviously we are experiencing quite high levels of absence and sickness in the NHS at the moment. So it might just be worth clarifying that with them. I just also want to just point out to you at this time, if you have a CT scan in the foreseeable future, I just want to remind you that CT scans for disease surveillance in cancer and mesothelioma are still going ahead, pretty much as planned. However, we are asking people to attend their CT scan where possible alone and not to have family members accompany you to the hospital. We want to reduce the footfall through the hospital. Some hospitals are asking you to wait in your car and are giving you a call when your CT scanning slot is ready, and then calling you in at the last minute. So also, please don't hang around in the hospital immediately afterwards, and obviously observe all the hand hygiene guidelines. So washing your hands and singing happy birthday twice through while you're washing your hands. And then if you are one of those people, and that I know that the Mesothelioma UK nurses have had lots of calls about this, if you are concerned about attending for your CT scan and are considering deferring your CT scan, maybe just the next appointment, or want to defer it by a few weeks, then please do give your key worker, your cancer nurse specialist, your Mesothelioma UK nurse a call just to chat that through, because there isn't any blanket advice we can give with regard to deferring CT scans. For some people it'd be perfectly acceptable, and for other people we'd probably be a little bit more concerned. So please do pick up the phone, have a little chat with your key worker. If you can't get hold of them, one of the Mesothelioma UK nurses will be very happy. Call our information line 0800 169 2409, and one of our Mesothelioma UK nurses will talk you through that as well. So I think that's all I want to cover in terms of disease surveillance. We will write up that advice that I've just given to you and have it available as a checklist or a pro forma type form that you can download or just run through and perhaps have to hand if you do have a telephone consultation. So now I'd just like to thank those people that have sent some questions in, and I'm hopefully going to have time to get through most of them. So one person has asked about current chemotherapy. They have a family member whose next chemotherapy is due next week, and they're really anxious about contracting COVID-19 whilst they're in the hospital, and am I aware of any extra precautions that have been put in place to protect patients having treatments? Well, the first thing I want to say is that before any treatment continues for any individual patient, there will definitely be an assessment of that patient, maybe not face to face, but behind the scenes, where they will be looking at the risks and benefits of continuing or deferring that treatment or pausing it for a period of time. So absolutely, there is extra measures put in place, and every patient that is due for chemotherapy will be assessed in terms of the risks and benefit. If the medical team decide that on balance it is in this patient's best interest to continue with chemotherapy at this time, then yes, there are extra measures that have been put in place. So I know that patients are being given medication routinely now to help support their immune system through chemotherapy. They are minimising the amount of time the patients spend in the clinic. The patients are being given extra advice and support whilst they're on chemotherapy. Some hospitals have actually moved their whole chemotherapy suites to a different hospital so that they are minimising the possibilities of immunosuppressed, more vulnerable patients coming into contact with patients with confirmed or potential COVID virus. So I can reassure you that lots of steps have been put in place. You will notice that hospital staff now are routinely wearing PPE, so masks and goggles and gowns and gloves to protect themselves, but also to protect the patients that they're caring for. So if your chemotherapy is planned and scheduled for a week or two's time and you're concerned, rest assured all of that assessment will be going on behind the scenes, and if they think that there is risks outweighing benefits, you'll be getting a call to talk to you about pausing or deferring treatment, and treatment will only go ahead where they think the benefits outweigh the risks. Another call has come in from somebody who is isolating post-chemotherapy, and the district nurses are still coming in weekly to look after their long line, their PIC line dressing. And at the time this question came in, those district nurses were not wearing PPE, and the patient was concerned about the risks to them of contracting COVID-19 from those community nurses. Well, as far as we're aware, all primary healthcare teams now should be wearing PPE. And so what I would say is if that is still ongoing, then I would make it very clear to the community nursing services that you're concerned. It shouldn't be due to access to PPE now. I think that access to PPE has improved tremendously. And also, you know, 2 or 3 weeks ago, the situation was very different. So the prevalence of COVID was different to what it is today. And so wearing of PPE has been ramped up to correlate with the risks of contracting the virus. So I hope that that situation has now changed, and it certainly should have done, and you'd be very right to raise that concern. If someone like me with a medical history contracts COVID-19, there's been some concern about whether there would be even any attempts to admit you to hospital or to be treated. What I can assure you is that, as you've been hearing on the daily briefings from government, that capacity is an issue for acute beds in some parts of the country, but generally speaking, our intensive therapy and our intensive intervention bed capacity is still addressing capacity issues. So we still have beds available, and as far as we are aware, decisions are made on an individual basis that is appropriate for that patient, and these are not capacity issues. These are based on the individual needs of that patient. So if you unfortunately find yourself in that situation where you're ill enough that you need to be admitted to hospital, then of course every attempt will be made to support you with whatever needs you have due to the COVID-19. We've also had quite a lengthy question come in from somebody who's had a post-operative complication, and I just wanted to reassure that caller that we're going to be sending quite a comprehensive response specifically for you, because it was a bit too much for us to discuss on a Q&A live. So the person who sent in the question about their father who had post-operative complications, just please be aware that an email will be coming to you from one of the Mesothelioma UK nurses very shortly. So the last thing I just wanted to mention to you today is that we as an organisation are a member of Cancer 52, and Cancer 52 is an organisation that represents cancer charities that are aligned to some of the more rarer cancers where the number of patients affected are less. So it's a group organisation, and Cancer 52 has arranged, which we're very pleased about, some one-to-one conference calls with NHS England, and Faye Ford, who's the business manager for Mesothelioma UK, has been on that call this morning with NHS England, and I wanted to give you, just hot off the press, some of the advice we're getting from NHS England. So there should be, for all those patients that are shielding currently, there is another letter going out to patients that are currently shielding. It's not about information on how to shield, and remember, we have recommended that all patients with mesothelioma follow the shielding guidelines. So those of you that are on the list of patients that are vulnerable should be getting another letter, and it's about information for how to look after yourself while you're shielding, and also some practical information about claiming sickness benefit. So look out for that letter, and if you don't receive one, then do contact your key worker, your cancer team, who may be able to share that information with you. For those of you that are in the midst of treatment or were expecting to start treatment soon, NHS England wanted to reassure all of you that if your treatment is cancelled, that is not because of capacity. That is not a capacity issue. If your treatment is cancelled, it's because it is in your best interests to pause it or to defer your treatment for a period of time. So capacity in chemotherapy centres and chemotherapy hospitals and cancer centres currently is not an issue, but treatment is being altered for some patients, and that's purely because it's in that patient's best interest. And they said that that message was very important for us to convey. So I think on that note, I'm going to wrap up this morning's live Q&A. We're going to be continuing with this every Tuesday at 11 o'clock. Please do send your questions into us and your concerns. Remember that Mesothelioma UK is here for you every day of the week. You can contact us through the normal means, through our email, through our website, through our social media, or through our information telephone number. And the Mesothelioma UK nurses are on hand to support you with any questions or concerns that you might have. I'd like to just remind you, we still urge you to follow all of the shielding guidelines. The weather's going to be beautiful, enjoy it, but please don't take your foot off the gas. Please don't expose yourself to any potential risk. We still need to be vigilant, and we still need to follow all those shielding guidelines. Please take all the advice we've said about remaining connected to your family and friends. Use social media. Think about using video conferencing and setting up some, family afternoon teas or breakfast meetings where you just get on the video conferencing so that you can feel as close to your family as you possibly can. I would like to, on behalf of Mesothelioma UK, and I'm sure you'll all join me with this, we'd like to wish Mr. Johnson well. We hope that he has a speedy recovery, and we're sending all of our heartfelt support to the team at St Thomas's who are looking after him and all the other patients currently. With that, please make the best of Easter that you possibly can. Enjoy your gardens, enjoy the birds, the flowers and the fresh air. Look after yourselves, and we'll look forward to our Q&A 11 o'clock next Tuesday. Stay well, everybody. Bye-bye.